It wasn't that they were overfat. These patients with dementia and these patients with other disease processes, what they had was they didn't have enough skeletal muscle. They had unhealthy skeletal muscle.
Look at that. Unhealthy skeletal muscle. You got to take care of that skeletal muscle. You can't just waste away. That's the thing. It's like when you waste away like that, but you look like your normal size, then you become something that's called skinny fat. And skinny fat's where you have poor metabolism because you really don't have developed muscle. And that means you also have weak bones. And that means if you fall, you have a greater chance of doing something like breaking a bone if you have weak bones. So, I mean, wow. Okay, let's go on. Hello there, Adam Cardona from League Healer Sports Massage, and today we're going to be doing a little bit of a commentary video. We're going to be looking at Paul Saladino. I think he's talking about an important topic here. It's on the topic of eating to prevent muscle loss. Now, I'm going to open up this video. All right, so here it is, eating to prevent muscle loss.
There is this sort of, I don't know if it was the same when you were in medical school, but this sort of subtle brainwashing.
Subtle? Oh, it's still happening.
That humans, it probably is that humans just become decrepit. And it's not our fault that our blood pressure rises as we age, that we become more insulin resistant as we age. And we mentioned this earlier, that perhaps that insulin resistance is due to less movement. But I also I really believe strongly that all of these things are due to dietary accumulation of garbage as we eat.
But yeah, we eat a lot of junk, and I'll be honest right there with that one. And I've been personally trying to keep my diet as clean as possible the more I learn. And outside of massage and recovery and athletics, I think that diet is super important. So let's hear what this doctor has to say further.
We'll look at professional athletes and say, how can diet be important for muscle health or health of humans when the best athletes on the planet eat McDonald's and chicken nuggets? And my answer is, well, give them 10 years and see what they look like, because it accumulates. And I think that
that is so true. When you're eating a bunch of garbage, yeah, your stomach can handle it, but it's going to accumulate and beat you up over time. The body can handle a certain amount of poison, but you got to really be putting quality nutrients and quality food in there.
Is a tipping point for most of us. And the takeaway that I get from this is, hey, look, seed oils are not benign, and the accumulation of excess linoleic acid in mitochondrial
he's going to talk about seed oils.
Any tissue in the body probably also contributes to worsening insulin resistance as we age. And it's wild to me that Western medicine doesn't have this awareness, and that it's just this kind of, I don't know, this kind of this the default. Like, hey, your patients are going to get more obese, they're going to get weaker, they're going to get more chronically ill as they age, and good for you. We have these wonderful medications for you to give them.
Yeah, that's one thing. So I might get a little bit of hate for this, but he does question or just talk about Western science. And it's really true that Western health science is its own animal to itself. I actually went to a school that really focused on Chinese medicine and also massage therapy, because they made a whole bunch of acupuncturists and other stuff. So I got a little bit of taste of the Eastern medicine and the Eastern philosophy behind their medicine. And it really is two totally different approaches. Let's see what it goes into with this.
There's no discussion of like how we avoid that. So how do you think someone can best support their muscles nutritionally? Like, what do we need to put in our bodies to support this organ?
Well, I want to frame this. I don't know if I've ever told you this story. Did I ever tell you about some of the research that I did when I was at WashU?
No.
Where these concepts came from? I'm going to frame it for you because it actually piggybacks lovely off of what you're saying. I did 2 years of geriatric training, and I actually didn't want to do it. The deal was, I mean, no surprise, right? End of life, very depressing, working in the hospital. You know it, right? You did it for a period of time. Before you did psychiatry, you did cardiology, and it is not a beautiful place to be. It is heart-wrenching. I wanted to go back, so I did an undergraduate in nutritional sciences, and then I wanted to go back and do a fellowship in nutrition. In order to do a fellowship in nutritional sciences and not just have it be medical, I had to get funding. The way that I was going to get funding was I agreed to be a geriatric fellow. So I had a dual role as a geriatric fellow, which is an individual who takes care of individuals over the age of 65. My role transitioned through the picture of the majority of 50-some-year-old women that we see today. She was a mom of 3. She had cycled through years of losing the same 10 to 20 pounds. The medical community had given the advice to eat less, exercise more, do Weight Watchers, continue to restrict your calories.
Calorie restriction. Now there's something. calorie restriction is going to eventually, if you're doing it for too long, it's going to equal nutrient deficiency. And one thing you have to do when you're trying to lose weight is you really need to cut down the calories, but you could also do that by burning calories and or increasing your metabolism through strength training. And that's when you're strength training, you increase the size of your muscle, and the muscle has to work more, and because the muscle works more, it has to recover, and when it has to recover, then you have protein and the muscle rebuilds itself, and then it makes itself stronger. Also, another benefit about building strength is, aside from it strengthening your muscles, the muscles, they go to the tendons, and then the tendons attach to the bone. The stronger the muscle gets, the more it has to pull on the bone. Then the bone has to compensate, and it builds more bone, builds more strength. So then not only does your muscles get stronger, you increase your metabolism by increasing your metabolic fire, but you're also going to help your bones and your bone density, especially when you're younger and your body's still in that building phase. You want to be able to build stronger muscles and build stronger bones.
When we imaged her brain looked like the beginning of an Alzheimer's brain.
Holy.
And it was at that moment I felt, I mean, you know how it is. There's always that one patient that you really connect with and just love. And you don't want to see anything. I mean, you feel that way about all your patients. But there was this she pulled at a heartstring. And we failed her. We failed her. The medical community had failed her. She had done everything that she was told to do.
The calorie restriction led her to having a pre-Alzheimer's brain. Now that's interesting. You see, this is something, it's news to me. And it's just like, it's amazing to see all the effects, the negative effects of caloric restriction. It's like we're learning more and more about caloric restriction and the bad side about it as time goes on. Let's hear what she has to say further. Wow.
She ate less, she exercised more, and in the process, over and over, year after year, she totally destroyed her skeletal muscle. Her body fat was easily 35% with very little skeletal muscle. She had issues with blood sugar regulation, insulin, triglycerides, all of the things that you would imagine for it to happen. The thing is no one had given her any advice to improve her skeletal muscle, which is at the core of these issues. Skeletal muscle is just the focal point. To do resistance training and to improve the quality and nutrient density of her food with high quality proteins. And I feel like it just totally destroyed.
Hell yeah.
And then I started to think, what is the one thing that all these sick patients have in common? And quite frankly, it wasn't obesity. It wasn't that they were overfat. These patients with dementia and these patients with other disease processes, what they had was they didn't have enough skeletal muscle. They had unhealthy skeletal muscle.
Look at that. Unhealthy skeletal muscle. You got to take care of that skeletal muscle. You can't just waste away. That's the thing. It's like when you waste away like that, but you look like your normal size, then you become something that's called skinny fat. And skinny fat's where you have poor metabolism because you really don't have developed muscle. And that means you also have weak bones. And that means if you fall, you have a greater chance of doing something like breaking a bone if you have weak bones. So, I mean, wow. Okay, let's go on.
And that's where muscle-centric medicine came from. I just wanted to share that because it really does piggyback to what you're saying.
Muscle-centric medicine.
Why is skeletal muscle so important? And
interesting.
Missed the boat. And in fact, we don't even measure it directly, by the way. When you get a DEXA is body fat percentage. You're laughing because you know exactly what I'm talking about. And you can recognize that we've built a foundation of information and knowledge on the shoulders of things that are surrogate markers. And when you do that, inevitably, there is going to be a shift, a change in paradigm when we begin to directly measure this tissue, which is actually what's going to happen through something called a D3 creatine. It's a deuterated creatine. It's tagged creatine.
Whoa. Little above my head.
How much muscle mass you have. It's going to be urinary test. You're going to be able to see how much muscle mass.
Okay.
And for the astute listener, you're going to think, we were talking about muscle mass and strength. The literature, the large body of literature would suggest that mass doesn't matter, which doesn't make any cognitive sense. The idea that skeletal mass doesn't matter, that it's all strength, that really it's about strength. And my argument would be, well,
I could see that.
Right. And what we're starting to see is as soon as we begin measuring skeletal muscle directly.
I could see that because when you're strength training, you improve your skeletal muscle. So the best measure would be strength for your relative size and age. Because if you have the strength, that means you have the skeletal muscle capabilities. You've made the improvements on your skeletal muscle. So, I mean, measuring it by strength totally makes sense.
Then yes, there is a relationship between skeletal muscle mass and strength. And actually the loss of skeletal muscle is more impactful than the gain of body fat as we age.
Look at that. That is one thing. So What she said right there is amazing. So basically, it's more important to have muscle than gaining fat. So you could be fat and muscly if you want, and that's actually better than just being skinny fat. So make sure that you're building muscle. Do that strength training. People just think that caloric restriction and doing massive amounts of cardio is good for them. No, it's not. Basically what you have to do is you have to build the strength. You can do the cardio afterwards, but if you're increasing your metabolism through strength training and you're burning more calories for every action that you do, doesn't it make sense that you do strength training just to improve the output you get from your cardio? Now think about that, because you'll be not only improving your strength, which improves your skeletal muscle, but you'll be more of an efficient calorie burner. And if you're really looking to lose that weight and burn more calories, you should really think about this game plan seriously.
And that's something that can't be emphasized enough. That's essentially sarcopenia, right?
Yeah, it is sarcopenia, yes.
Which is a term, in case people are not familiar, help us understand what sarcopenia is.
Yeah.
Are you ready?
Break it down.
Have your mind blown? Well, maybe everyone else maybe have their mind blown. The International Classification for Disease, which if you're a physician listening to this, you know that this is the ICD-10 code. Sarcopenia is the loss of skeletal muscle mass and function. It's believed to be about 1% per decade after 50
Yeah,
years.
I've heard that one.
That it is higher, and I believe that it starts much earlier. I believe it starts in your 30s, if you were inactive, just like heart disease and Alzheimer's.
I could totally see that, because I've seen it. Like, I'm older than 30, and one of the things I've seen, even I would argue even at 25 is, and I've told this to some people, but I'm glad I'm making it public right now, is as I've watched growing up and having people, my peers that are the same exact age as me, as I grow up and they're inactive and I stay active, I see all the differences in, like, not only just strength, being more injury prone, being more fall prone, easy to get fatter, more just problems overall. And really, it's amazing that just by keeping strong and making that your foundation, you can really avoid a lot of different problems that are related, that these two in their dialogue are really bringing to light here.
The ICD-10 code for sarcopenia, to recognize it as a disease, was 2016. Tell me that isn't mind-blowing.
It didn't exist before the last few years.
It wasn't recognized as a disease. And I want to highlight something else, that if you look at the causes of mortality, so the number of deaths for, according to the CDC, you have the top causes of death: heart disease, cancer, accidents, stroke, chronic lower respiratory diseases, diabetes, Alzheimer's, etc. Nowhere on that list will you see loss of skeletal muscle or sarcopenia, as well as obesity. You don't even see that on the list. Skeletal muscle is directly related for all of those that I listed, if not the root cause.
So in some ways, just like Alzheimer's disease,
skeletal muscle and having good skeletal muscle seems to be the key here, is what I'm gathering from this conversation. I missed her name, but obviously I'm on Paul Saladino's channel. Also, if you're liking what you're seeing so far, don't forget to like this video, and if you think one of your friends would really enjoy this, then make sure you share it with them. I appreciate it.
Is a loss of neurons in certain parts of the brain, the substantia nigra, the dopaminergic neurons in the brain. Would you characterize a lot of the chronic disease we have as a loss of muscle? And no one is really thinking about it this way. Like, we're losing critical things for the body, just like neurons are critical. A brain, we're losing muscle with sarcopenia here.
I would say that when we think about what are the things that actually kill us from a metabolic perspective, the root cause is skeletal muscle. And again, there's many mechanisms, whether is it an insulin resistance? Is it ceramides? Is it a mitochondrial dysfunction? Is it a receptor issue? I mean, there could be a million different, if you just Google, causes of, pathology in skeletal muscle, you'll find a million, right? I don't know if anyone decided.
Got me wanting to look it up.
But one thing is for sure, it is the one tissue that you can do something about. And exercised, well-trained skeletal muscle is healthy skeletal muscle.
Look at that. I love it. Hallelujah, holler back. She just basically is saying what I've seen in my life this entire time. Healthy skeletal muscle. It's the key to everything. You have to strength train. You have to build yourself up that way, because it's going to prevent a lot of problems going forward. It's not like, oh, I want to look like Arnold or some bodybuilder, or I want to avoid looking like whatever. No, you need the basic strength for life. Also, if you're training the right way and training functional, you're going to also help out your posture and take care of yourself. So not only will you be strong and fit, have a good metabolism, you'll be able to just take care of yourself in so many other ways.
So what do you think is causing the muscle loss? Like all the, like sometimes the research landscape is frustrating to me because randomized controlled trials are super valuable. And sometimes if we don't have them, we have to use our intuition and think as humans. What's your suspicion as a physician, as a clinician, of what is going on with sarcopenia, this loss of this critical endocrine immunologic organ in the body? Why are we losing this? Why is my mom losing this? Why is my dad losing this? Just like the loss of neurons in the brain with Alzheimer's or dementias or neurodegenerative diseases. We essentially have musculoskeletal, we have muscular degenerative diseases as humans. Like, what do you think is going on? What do you believe, what do you suspect as a physician is going on?
When I think about the hallmarks of aging, I think about protein turnover and proteostasis. And I believe that we are not able to keep up with the lifestyle. So humans are largely domesticated. This is a Western.
Humans are domesticated. I could see that. But that's funny. Oh, that kind of hurts to hear that one.
This is not a disease that I believe has to happen, by the way. What I believe...
Yeah, we're too lazy. We don't move enough. We got to do more as a Western culture, and you got to live that active lifestyle.
Is happening is twofold. Our nutrition as we age is totally off base.
Yes. Oh my God. Nutrition is off base. People don't care enough about their nutrition. I totally see that. Being that my office is like shared, we have people down the hallway that do different things. I see because we all have to put our garbage out at the end of the night, and I see what some people are eating. Man, it's sugar. Woo! And that is not good as you get older, not to care and to be eating sugar, because there's a lot of, I'm reading up on it, and woo, there's a lot of problems with sugar. I don't want to get into it. Actually, you know what? I'm going to cut this out of YouTube, what I'm about to say, and just leave this for a Rumble.
It starts young, habits start young. We do not keep up with our changing physiology. And the balance between exercise and movement and nutrition changes. When we're younger, again, you could have done bicep curls in college and you probably were eating some Twinkies or something else, and you were still able to put on muscle. Let's be frank, okay? You were able to do all those things, whether you got eczema or psoriasis or whatever it is. You were able to do a lot of things that potentially wouldn't be healthy, and you still probably looked great. As individuals age, that wave of youth closes, the capacity to leverage the youthful hormones, to leverage the body's plasticity, while the window never completely closes until it's over, the ability to push hard enough to stimulate that tissue becomes more challenging. I believe that we are under eating dietary protein.
So what does that mean? Get your kids to work out.
I believe that we are eating too low of a nutrient-dense diet from an iron standpoint, from a B12 standpoint.
Amen.
From all these
Preach.
Nutrients that we need. And we are not
totally nutrient deficient. There's a lot of nutrient deficiency because of the lack of quality foods that we eat. You got to really think about it. It's not only the activity, it's not only the exercise, and get your kids to exercise, but it's what we put in our bodies, man. You are what you eat. Really, 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 really.
Pushing our bodies hard enough. We are deeply domesticated.
That hurts to hear that.
Some low-level inflammation. You throw in some shitty food. You throw in lack of sleep, which also suppresses this.
Oh, here we go again.
I was talking to one of the researchers out of Galveston, and one night of sleep restriction might affect muscle protein synthesis by 18%.
You gotta sleep.
One night. Crazy.
If you really want to build muscle and have that protein synthesis going on, get the sleep. The rest is as important as the work. That's why I have Elite Healers Sports Massage, because I've learned how important recovery through massage, foam rolling, stretching, sleep, they all are. Your recovery, your strategy on recovery is just important, dare I say, possibly more than the work that you're putting in.
And that's what I think is happening. And the other thing is the nutrition landscape is never empirical. It's never an empirical conversation. It is a conversation that is wrapped with politics, that's wrapped with morality, wrapped with things all related to other aspects than actually the data.
Ooh, yeah. So you see, that was actually good. Hold on. Let me take this off share. Yeah, you see, that was what I'm talking about. That is important. You have to eat right to prevent muscle loss. And whether we learn here, you got to make sure your skeletal muscle is strong. By making sure that your skeletal muscle is strong, you have to do the strength training, aka the resistance training. get that in, get it in a regular cycle, and then make sure you're doing stuff like eating right to prevent the skeletal muscle loss and to keep your metabolism up. You got to get a lot of protein in there. You got to prevent yourself from having excessive carbohydrates, especially carbohydrates that don't provide any nutritional value. So I'm sorry to say, you got to stay away from those dessert foods, which was just discussed in this video. And those are the things that are the key to success. So that way, if you're doing it right, if you're watching this, you're in your 20s, 30s, 40s, and maybe even 50s, it's still not too late. You still got enough life in front of you where if you just begin to make these changes, sure, it's going to be painful on the front end, but anything that you really have to work for is worth it, in my opinion. So you got to make those sacrifices. The worst time is the first 21 days, because anytime, studies have shown that anytime you're making new habits, it usually takes 21 days to build those new habits. So you got to at least put in the work for a minimum of 3 weeks before those changes begin to feel like habits. And then once you have those changes in and you're practicing them enough so they become habits, then you can make the upgrades, and then it becomes easier. And then after a while, further than that, it's going to feel almost automatic, like brushing your teeth. And these are the things that you want to do to make sure that you're making the improvements in your life. So if you want to watch more content that'll help you get better, click here. And if you want something else that I think you'll really enjoy, click here. Thank you for watching this episode, and I'll see you in the next video.